Imagine a debate between an 11th century medical genius and a modern-day YouTube doctor. In this corner, Avicenna, a Persian polymath, 980-1037 CE, whose Canon of Medicine became a foundational medical text in Europe and the Islamic world. In the other corner, Dr. Mike, Mikhail Varsavsky, a Russian-American family physician and internet personality with millions of followers. Today, they'll spar over ancient herbal remedies versus high-tech diagnostics, the nature of health, and the clash of worldviews. Let's jump right in. Welcome to our roundtable debate. I'm your host, and with me are Avicenna, often called the Prince of Physicians, and Dr. Mike, the social media savvy family doctor. Avicenna's Canon of Medicine, El Qanun fi el Tib, was taught for centuries and presented medicine in a holistic, systematic way. Dr. Mike, by contrast, edits podcasts and debunks pseudoscience on his YouTube channel. The first topic is the classic debate, traditional medicine, Avicenna's world, versus modern evidence-based medicine, Dr. Mike's world. Even today, over 80% of people globally use some form of traditional medicine, herbs, acupuncture, and more. Tradition still matters, but modern science introduced a rigorous approach, evidence-based medicine, EBM, which treats patients using clinical research. Scholars point out that Avicenna's methods were surprisingly scientific. Although the term evidence-based medicine appeared only in the 1990s, historians argue its roots go back centuries. Avicenna emphasized observation, logic, and even experimental testing of treatments. He wrote rules for testing drugs and distinguishing their effects, early analogies to clinical trials.
In my time, we observed patients carefully. We tested remedies through analogy or direct trial under specific conditions. Even without microscopes, we relied on reason, logic, and repeated observation.
Exactly. Modern EBM builds on similar principles, but with advanced tools. Today, we use randomized controlled trials, meta-analyses, and systematic reviews. EBM means applying scientific evidence to patient care while integrating patient values and physician judgment.
I emphasized not just drugs or surgery, but also environment, diet, and the psyche. Persian medicine was holistic, mind and body together.
Sure, but imagine being a doctor 1,000 years ago. Today we have microscopes, MRIs, labs. We quantify everything. Evidence-based means measure, test, analyze.
Tools change, but the goal remains: help the patient. We kept detailed case records and even dissected animals to understand anatomy. A good mind can adapt.
His Canon of Medicine was used in medical schools from the 12th to 18th centuries. His logic and methodology influenced scholars for generations.
And today we've built on that. Antibiotics, cancer therapies, vaccines, advanced surgery. Still, listening to patients and caring for mind and body remain essential.
Both sides seek health, but through different methods. Traditional medicine used observation and philosophy. Modern medicine uses statistics and technology. Yet definitions of EBM emphasize integrating patient values and clinical judgment, not just data. Could a doctor from 1,000 years ago adapt to genomics, AI, and modern diagnostics?
Avicenna would be amazed. Genomics lets us sequence entire DNA and predict disease risk. The first human genome took over a decade. Today, it takes a day and costs under $1,000.
Genes and DNA would seem magical to my peers, but I pursued science. I would have studied these letters of life with great enthusiasm.
Modern diagnostics include X-rays, MRI, PET scans, unimaginable in Avicenna's time. And AI is transforming imaging, spotting tiny tumors or fractures with exceptional accuracy.
AI reduces human error and speeds up image interpretation. It also predicts outcomes and helps personalize treatment using massive data sets.
And artificial intellect? Fascinating. I wrote about geometry and logic. I would certainly explore this tool.
Machine learning also enables predictive analytics, identifying risks for diseases like diabetes and heart disease. Personalized medicine tailors treatment to each patient's genes and lifestyle.
Even pharmacogenomics, choosing drugs based on genetics, echoes Avicenna's early ideas about individual constitution.
Knowledge is knowledge, whether humors or genes. The goal is understanding the human body.
Time for the big philosophical question. What is health?
For us, health was the balance of humors and harmony of body and soul. Illness meant imbalance.
Today, we consider mental and social factors too, but we heavily rely on measurable data, lab values, biomarkers, imaging. Still, numbers aren't everything.
Modern whole health models emphasize purpose, behavior, and environment, not just metrics.
A troubled soul cannot be healed by medicine alone.
True, genomics and lab data help predict risk, but emotional and lifestyle factors matter deeply.
Interestingly, modern holistic definitions of health resemble Avicenna's philosophy more than a purely data-driven model.
Soul and body must both be bright.
Let's compare worldviews.
I have millions of followers. Doctors today educate, entertain, and sometimes become influencers.
His public image grew when a magazine named him sexiest doctor alive, boosting his social presence.
Balancing accuracy and entertainment is tricky, but I try to stay true to evidence.
We didn't have social media, but scholars of my time also had reputations in public roles. Still, our aim was philosophical clarity, not visibility.
Avicenna wrote to integrate and teach knowledge. Modern medicine, by contrast, is influenced by business, branding, and media.
Imagine Avicenna on TikTok. He'd go viral explaining the humors.
In truth, both would value education, and both follow the same principle. First, do no harm. What a fascinating exchange! Avicenna's ancient wisdom stands surprisingly well beside modern science. His methods echoed the logic behind modern EBM. His holistic concept of health mirrors modern whole-person definitions. Technology like genomics and AI would have intrigued him. His philosophical worldview contrasts with today's media-driven medical culture.
Shall we swap roles next time?
Deal. You try TikTok, I'll try bloodletting.
Thanks for joining us. Remember, medicine is art and science, heritage and innovation. Stay curious.